this is our very first networking and information resource session that we're going to be hosting throughout the year. So we encourage you to join us for the following ones that are coming up. And we didn't have enough time to really market this session, so thank you all for being here. We're still going to record it because we want to get this information out to as many business owners as we can. And I want to thank Tim for joining us this morning. He has been a great partner to us and to our small business community, and I'm super excited to learn from him and for you all to learn from him as well. So at the Master Center, if you're new here, we're a business incubator and accelerator. We support small businesses with office space, but also with various different resources in order for them to grow and expand. So my name is Mari Zavala. I'm the executive director here, and this is Michael Hinojosa, our programs coordinator, and he'll be introducing our speaker this morning.
Yes, our speaker today is one Tim Kelly from Marsh MMA. We are very excited to have him here today. He has been working in this business for almost 30 years now, so he is for sure the expert when it comes to things like this. So without further ado.
Thank you, Michael. Thank you, Marty.
Thank you.
Well, obviously, this is a very casual meeting this morning, so ask questions. So at Marsh McLennan, as an insurance broker, this is something we've gone to market and put together. I don't work for this insurance company. I really work for y'all to communicate this to your business and your members. So let's keep it pretty casual. I try to keep it high level. If you want to go deeper, I'll be glad to. So I'm going to go over this little brochure that I handed out to everybody. And basically, Maestro, just a little background, had approached us last summer, let's say, to try to put together some type of benefit program that these small businesses could offer to their employees. And the thing that we came up with, because we wanted to try to keep it simple from the employer, from an administrative perspective, is that the employees will pay for this directly through their checking account or savings account, however they want to set it up at the bank, versus you, the employer, having to have a bill, monthly bill, payroll deduct. It's voluntary, but you as the employer, you can't pay the cost directly for your employees. But if you want to, a business decision, if you want to gross up their pay, give them $100 extra in their paycheck to have access to this benefits, that's your call as a business. But otherwise, it's the cost will be the direct pay from the employee, and it's a discount medical, dental, and vision program. You have to sign up for the health insurance in order to have access to the voluntary dental and vision. And these rates are discounted probably 20–30% less than you could buy retail. You really couldn't buy this on the retail insurance market. Some people may go to the Affordable Care Act and the exchange to buy individual health coverage, but this is totally separate from that. And no,
when you say the employee, so the company still has to be enrolled as a business before they can go out and just buy the insurance.
As long as Maestro is a member, or your business is a member of Maestro, then you're eligible to then have access to this insurance coverage to offer to your employees.
So it's not for all small businesses, it's only if you're affiliated with
That is right. So I see where you're going. So you just for your employees, your 1099, your W-2 employees that are on your payroll at your businesses, those are the ones that are eligible, and their spouses and their dependents also. But not like my grandmother or my uncle who lives down the street. It has to be your family.
So do we have to have an office space here in order to?
No, there's no cost associated.
No.
You just have to register to the bilingual state website, and we'll walk you through that once it's done, so that you can really understand how to go in there and just register and put all of your information in there.
If the owner wants this coverage, they have access to it, and the employees also have access to it. Very good question. So coverage differences, let's say from yours is COBRA or a group health plan or individual health coverage. The basic differences are this is what I call a limited medical plan. It covers more of the things that you use more often, like office visits to doctors, prescription drugs, outpatient surgery, things like that. You get limits of insurance for those different types of coverage. Now, your COBRA plan or a group employer health plan is going to have more catastrophic coverage. It's going to have full hospitalization with some, cost sharing on your part. So this one, we wanted to design something that was affordable, something that employees could use, what they wanted to use it for, with dental and vision was kind of the thought process. Yeah, and I'm going to go through the benefits, the medical benefits. I'll try to keep it high level. If you want to go deeper, that's fine. Dental and vision, and there's a teledoc option. It's just it's packaged together. It's just all together into one price. And this is the monthly price. We'll look at it. So look at, I guess, the first page. So your plan, Apex is one of the administrators. They're the administrator on the preventative services and the teledoc, the outpatient physician services. And we package that together with Beasley, who's the insurance carrier, and they're the ones that provide the benefits for hospitalization, ER visits, and doctor visits, and things like that. So it's kind of a package together. And this, the MEC plan up above says MEC Plus. It just stands for minimum essential coverage. It provides you the minimum essential coverage that the Affordable Care Act required you to have years ago. So it's a combination of telehealth. You have a doctor's network or teledoc. So teledoc is a 24/7, 365-day a year where you can get online with a board certified primary care physician and could handle a number of different things. I mean, you're dealing with cedar allergies, you're having an upper respiratory issue, pink eye, you just got flu, virus, whatever's going on. You can just go, have access to that directly for you and your family. That's a very nice benefit. Obviously, it was very popular during COVID, and a lot of group health plans and employer health plans usually offer some type of telemedicine benefit. The physician network is there's a large, I call it in our world, the acronym is PPO. It's a preferred provider organization, which means a large group of primary care doctors and a large group of specialists participate all over the country in this program. So they're discounting their services, 15 to 20% or more, depending on what you're seeing them for, to access this coverage because you're part of that network. So there should be a little disruption. We want to make sure. Now there's information to go on their website through MultiPlan on how to look at the doctors at your zip code, or just call your doctor and say, hey, are you part of the private healthcare system's PHCS network? And then there's citizens. There's a pharmacy part of it. There's a pharmacy benefit part of it, and that's through citizens. So it's all packaged together into one plan. I'm just kind of breaking this out for you. So let's go to the second page on the covered services. And this is the section on the health benefits. As I mentioned before, the preventative care is covered at 100%. That's free to the employee. It's free through teledoc and those other services. So no copays, 100% covers. And the teledoc 24/7, that's unlimited. There's not, you can call them every day if you needed to for your family. If you have a bunch of young kids, you have a lot of issues and things going on, but their teledoc is 24/7 also. So it uses the private healthcare systems network. So these are the benefits. These are the copays that you pay when you go to the doctor. So if you see a primary care doctor, which are like your general practitioners, your internal medicine doctors, it's a $20 copay, but there's 3 visits in the plan here. So you go in for 3 doctor visits during the year. For a specialist, $50 copay, 3 visits during using the PPO doctors in the network. Urgent care, like the Texas Med Clinics, you pay a $50 copay for 3 visits per year. X-ray and lab, your preventative care, that's covered at 100%. But if you're sick or hurting, doctor says we need to do an X-ray or you need to get some blood work drawn, then that's covered. 5 services per plan year. And
So
then
what happens if they go beyond, let's say they have a rough year? And
Right.
they use services more than what's allowed?
it's a very good question. If they go past these limits, then they still can use these private healthcare systems physicians where they get the discounts. They get the 25 to 30% discount if they're a cash pay provider going forward.
So
Pay at the discount rate. This plan doesn't really have a deductible, which is nice. There's no deductible. It's kind of think of it as a copay plan with limited visits during the year. So you don't have to worry about deductibles and co-insurance and all these terms that can confuse people with insurance. And the prescription benefits, there are a number of pharmacies in town. You can go online and see the different pharmacies, but I'm sure they have the HEB and all of most of the pharmacies in San Antonio. And it depends on the drugs fall within different tiers. These drugs will change all the time. You may be taking a tier 2 medication where you're paying 10% of the cost, and Next month it bumps to tier 3 and you're paying 20% of the cost. It's because new drugs are coming online all the time and patents are expiring and then they go generic. And so things change. That is right. That is what you pay. They're paying. So on tier 2 on generics, the insurance is paying 90%, you're paying 10%. Or 20%. So of course, as the expenses get higher in the different tiers and to get into some of the specialty medications, it can be very costly. You could pay 40% on that, but it's still a much better discount than paying full retail. And it talks about specialty and non-preferred. So it just gives you, there's a whole listing. And when you go to the website, you can see the different drugs that are in the different tiers. Or when you go to your pharmacy, they'll be able to show you what your co-insurance is. So for the hospital part, the next section is the hospitalization. This is the indemnity part. So if somebody is hospital confined, this plan would pay no deductible. It's $1,000 per day, up to 30 days per plan year. Hospital intensive care, $1,250 a day for 10 days, and other hospital admissions due to sickness or injury, $2,000 per day, just for 1 day a year. So again, that's the catastrophic portion. If you don't, if your claims go over that, you get the private healthcare system's discounts.
Is there just curious, like, you don't know when you go to the hospital, but, and then you say you have an accident, right?
Mhm,
Like,
mhm.
2 weeks and now that's like $14,000, right?
Right.
Is there like something else that you could do or that like I could add, you know how like Aflac or something like that, there's like,
Yeah.
like an enhanced, like another policy that I can use to back that up?
Yeah, there are some that are out there, usually like I call them in our insurance world, hospital indemnity. It just means if you go in the hospital and you stay just like this, it's going to pay you so much a day, but you can extend the number of days. That's a separate individual policy that you could buy. You can.
And it's just, I'm just kind of like thinking worst case scenario.
Yeah.
You know, I don't want to, some emergency happen,
Right. Well, there's 2 ways. Usually like some of the hospitals will have a way for you to, I mean, they understand if it's a $14,000 bill, maybe you get a 30–40% discount off of that, but you still can't afford the balance, but they'll work out a payment plan or write it off after a period of time.
Yeah. Because this is still something, I mean, at least you're not like 50,000 or 100,000,
Yeah, this is just designed to cover the things that you use more often. Yeah, more everyday things. With yes. This is what you as the member would pay. This is the cost that you pay per month.
Okay. Yeah. And it would be more than $1,000 actual cost, so it still covers some of the expense, right?
It does. And I'll go, there's, I'll list the surgery benefits and anesthesia benefits. Same thing. It covers like so much per day, 1 day per plan year for outpatient major surgery, outpatient minor surgery, inpatient surgery, anesthesia. So they break it down there. You have emergency room benefits. Try to use Teladoc as much as possible. You'll be surprised what they can help you with. Try to stay away from the emergency room if at all possible, because Teladoc is a 24/7, 365 days a year access to it. But if you do have to go to the ER for some reason, it's only going to cover $50 a day, 1 day per year. And an ER visit is going to run you $500 by the time you get in there, get out. Accidental injury, $150 per day, 1 day per year. So the rates, there's the cost of the insurance is right down there below. $217.44 a month is what the employee cost is. And that's what they would pay directly to the insurance company through their checking account or their banking account. And then you can cover the spouse, you can cover your children. If your spouse has other employer health insurance, you just want to cover you and the kids, you can do that. Or full family, which is you and all the children. Now, one thing I want to mention before I forget, now this plan, there's no, what we call in our insurance world, there's no underwriting with this. They're not going to ask you a lot of health questions, what's your medical history, what medications you're taking. They don't want that information. But this policy has a 6-month pre-existing limitation benefit. What does that mean? That just means that, let's say you sign up for this, let's use a calendar year, January 1st. Then anything that you're treated for 6 months prior to January 1st, that condition wouldn't be covered under the plan for the first year. So you, let's say you had cancer 10 years ago. Well, it's not a pre-existing condition. I hadn't had treatment for it in the past 6 months. But if you take high blood pressure medication, you have a heart condition, obviously you're pregnant, that's a pre-existing condition, that wouldn't be covered by the plan.
The medication
The
or,
medications or things associated with it, that's
so
right.
if you went to the doctor for that, you would not be covered?
Not if you've had treatment for it in the past 6 months prior to signing up. And that's to protect the plan and the rates and not picking up a, large claim. That's fairly typical on plans like this. Yeah. So-
Because like, reading the high blood pressure pills, those would not be covered in the first year, is that what you're saying?
That's correct. And I'll check on that. I'll follow up and get back with you on that.
Then I think that would be kind of a preventative.
The preventative services, anything under there would be, but if you're taking high blood pressure medication, that's not a preventative benefit. It's a medical condition that you're getting prescriptions for.
That's just preventative.
I will check on that pre-existing condition for like the drugs and things, but I know that applies to like the hospital benefits and the emergency room benefits.
So that would
things
be
like
for the first year, does that mean it kicks in after year one?
That is correct. I'll confirm that also. Yeah, Cobra coverage for you. I mean,
Well, it's just like the same plan.
it's sticker shock when you see what the employer is paying and then you're paying the cost. And it's anywhere from $500 to $600 a month usually.
Well, I see my kids, it's like 12.
Yeah, for any family. You're right. It's going to
But
be.
you know, because there's no limits like here, but I mean, I'm pretty, voicing that.
Yeah, so this just brings up a good point. If you're concerned more about the catastrophic, then you might want to stay with your Cobra plan or your other insurance plan. This just fits a need
Well,
for,
it's also that I could just offer it to my employees.
absolutely.
Maybe I could just keep one, but I could offer it.
That's right. And then they would, once they sign up as a member under Maestro, they go to the website, they get in there, it explains the benefits. There's a live chat in there for them to talk to somebody to answer their questions and then they can enroll.
No, it's okay.
So there's the pricing. Yes.
So how does this differ from, like, is that currently that which, is common with the US, the Obamacare, and, that other plan that's available for small businesses?
Through the big exchange where they,
The
yeah, right.
exchange, I mean, I haven't necessarily really looked into it. I had some people, like other business owners said that they're part of it and they save a lot of money. But I'm just curious as far as if you know the benefits from that compared to this.
The benefits through the exchange are going to be more like your Cobra benefits or more like individual health insurance coverage. So it's going to be full major medical, full hospitalization with drugs and things like that, where you have deductibles and co-payments. And that's part of that there's a minimum essential coverage under the Affordable Care Act along with preventative care. So again, the difference is just like before, it's that plan, the Affordable Care Act plans are going to cover more catastrophic, where this one is more limited.
Do you know by any chance like the pricing?
I don't, because it's based on your age and sex and where you live. It's age rated, and then they also look at there's an incomes test also. So if your family income is below a certain threshold, and based on the poverty level, they'll subsidize with our tax dollars and reduce your premiums. So that's but you have to go through the exchange to do that. Most people don't get the subsidy.
They don't get accepted?
No, most people don't qualify because of income. If they're working, yeah, that's right. If not, then that's where place to go, or Medicaid, yeah. So the next page just talks about, we already went over this, but it just talks about the preventative care. Just call your private health care physician's doctor that's part of the network, set your appointment, show them your ID card, and then all your preventative care is covered at 100%. And here's the private healthcare systems, how to find the doctor. We talked about that earlier, how to find a provider. They have every hospital in San Antonio. They have a lot of specialists, a lot of primary care doctors. It's a very broad network. I have this network for one of my clients that is a large business with multiple locations. So it's a good network. Good question. It does cover the mental and nervous part of it. It's limited to, your cost is $80 for the hour consultation. And any consultations after, so the first one would be an $80 copay that you would pay. And any consultations after that, you get 3 visits, you would get the discount after that. So $80 an hour for a consultation. Once you exceed 3 visits, then you get, no, it's on my notes. Yeah. But it's
So $80 that first one, and then after that, it's what?
it's going to be for $80 a visit is what you pay for 3 visits, and then you get the discounts going forward if you need more visits than that.
And then you can check to see if that don't-
Correct.
you can discuss it or-
Right. So that's the first thing you need to do is make sure that they're in the network. And then if you have more visits than 3, then you get the discount going forward. And that's been a big thing with COVID and everything. Mental and nervous benefits are really important now.
to have the kids. So I'm thinking of. It's a real- And then I put them on this. But then I thought, oh my God, there is some. How is it? We go. Doesn't it?
Yeah, it covers it. I don't know. It depends on the therapist and yeah, through the network.
I was thinking, even for my employees that.
So just kind of moving along, I'm not going to go into a whole lot of detail on the next page just talks about the ID card. You know, this is an easy plan. It's affordable. It's convenient. This is kind of what the ID card looks like. It's got the PHCS emblem, so they'll see that the doctors know this. The general accounting offices will know if they're part of the private healthcare systems network. Citizens RX handles the drugs, and then you've got Teladoc. You could add this as a secondary coverage if you have like health insurance through an employer and you want to add this as an additional layer. You could do that.
And how would that work?
Your group plan through your business would pay first, and this would pay second. Now, if you have no other insurance, then this pays first. Yeah. Or you could pay for both, but Cobra and this, that's going to be too much money. Yeah. Well, if you were using one of the PHCS doctors and they didn't have the administrative staff to file the claim directly, then you'd pay cash at the counter, get the discount, and you could file the claim with the private health, with the administrator, RCI administrators. That's right. So either provider will submit the claim, or you'll have to pay cash and you have to submit the claim to get reimbursed. Usually, if you're using a network doctor, like that $80 copay in my example on the mental and nervous, then you just pay your $80 and they're usually going to file it and you're done for 3 visits. Yeah. Good questions. Let's see here. So the next page is at the very top. It's this little page, VSP choice plan. This is the vision coverage. And again, you have to have the health insurance in order to have access to the dental and the vision coverage. And you have access to eye exams every 12 months, lenses for your glasses every 12 months, but frames for your glasses every 2 years. And there is the member pricing, which is a pretty affordable rate, $8.74 a month. Or you and one member, like you and your spouse, or you and one child, member plus one, member plus children. It could be it would be 2 kids or 10 kids. It's the same rate. It's a group insurance rate, and then member and family. And the benefits are on the next page. And basically, if you try to use the VSP providers, which are a lot of the box stores in San Antonio, and a lot of optometrists accept this. And then when you go in for your eye exam every 12 months, then you pay a copay. And you get a lenses, you get some lenses, bifocals, trifocals with all the shades on it or screens on it, things like that. You can get it for a certain reimbursement. They'll reimburse you up to $100 for that. And then the elective contact lenses. So if you want contact lenses, there is an election there for that. And it reimburses you up to that dollar amount on the right side for the out-of-network providers. So in network, the VSP Vision network providers, you're just paying, it's covered in full, or you're paying a copay. If you decide to use an optometrist that's not part of the network, you pay cash upfront, submit your claim, and get reimbursed the schedule on the right side. But it has, a lot of good discounts in there for even if you want prescription sunglasses and things like that. If you use a PSP provider, they'll provide you with a discount. Laser vision program. So there are some discounts if you're considering the LASIK or the laser vision surgery. There's some discounts for certain providers that you have in the plan. Questions on the vision? The dental plan, so it uses the Aetna network on the dental plan, the next page. And again, this is a voluntary benefit. And like most dental plans, it's going to cover your 2 cleanings a year, your preventative at 100%. So try to go in and get your cleanings and your x-rays done so it doesn't progress into the basic services, which are going to be like your extractions, your gum work, endodontics, periodontics, things like that. And then the major services is going to be like your crowns and bridge work, more expensive things. But this dental plan, you have a $50 deductible per year. But for preventative care, it's 100%. And the maximum amount that it pays out for the services for the basic and Class B and Class C services is $1,000 per calendar year, and then $1,500 lifetime for the orthodontia. So preventative care 100%, basic 70% reimbursement, major 50%, up to $1,000 a year. So a simple example: you have a couple of crowns, you have a bad year, it's $2,050. You're going to pay your $50 deductible, the $2,000 left over, they're going to pay 50% of it. You're going to get $1,000 back. That's your calendar year maximum. And next January, you can start over getting at your new calendar year maximum. Okay. And the other side just kind of talks about the more details on the Class A preventative services, B, the basic services, and the major services. It gets into more details as to what's covered under there. The other page is just to confirm with you that this plan meets the Affordable Care Act. PPACA is the acronym for the Patient Protection Affordable Care Act, and your plan is compliant with that. It doesn't meet the minimum standards for preventative care and the other coverages. And the last page is just about Teledoc. If it's very simple to set it up, you could, if you don't want to mess with it now, you can just make a phone call, give the doctor your medical history, credit card information, contact information, and they usually takes about 15 minutes on a phone call, or you can do it online ahead of time, and you're going to get a call back usually. If I need to talk to a doctor now, you're going to get a call back usually like 20-30 minutes. Someone's going to call you back, and you can because for any other charges, let's say they want to send over and get a, let's see, let me look at this. Sure, I'll tell you that. Yeah, you're right. Other than if they charge you for other services, it's not part of the call. It'd be free services for you, be 100% coverage. Yeah, but usually they require. I mean, if there are, sometimes they may give you some prescription that's not part of the covered medical plan. That could be your expense, but that's going to be a pharmacy cost at the pharmacy counter. Yeah, that's right. That's right.
I just didn't want to, not surprised if I say, oh, that's okay, you have to pay. You're saying it's a massive.
That's right. I'm looking at it here. Yep. Unlimited. You can use it as much as you want. So again, this plan is designed to cover the things that you kind of, I'm fairly healthy. I get sick a couple times a year. Maybe it's cedar fever. Maybe I get the flu. I need to go see a doctor. I need to call Teledoc. I've got prescription drug coverage, and I can have access to dental and vision. Want to again offer something that was affordable. If If you go to major medical individual coverage, it's $500 to $1,000 through the government exchange, or we have an office that does individual health coverage. It's usually very expensive insurance, high deductible, and your doctor network goes like this. You have a very limited doctor network. This is a very broad network of doctors and primary care physicians. And what we'll do, we'll try to get a video that we could post on the Maestro website, that if you want to refer your employee or members to the Maestro site, they log in as a member, they get registered, and then they can then see the link to go in and pay if they want to pay for the benefits. Yeah, what I'd like to do is just get I'm going to see if I can get through the services. I don't know if they do this, but they could do a voiceover, like a little voiceover PowerPoint or something that you can post.
Do what you're saying, it's just like a voiceover.
Yes.
Presentation, and you just go into each page, explain what you need to do.
Sure.
So that might be great, you know, to be able to help me as a business owner not have to explain.
No, that's the thing. That's why I don't expect you to remember all this. You just want to offer it to them, let them know it's available to. Yeah. Video, there's live chat if you have questions as you enroll, and all that stuff.
And I'll walk you through real quick how to get to the website and explain things to that. It's super intuitive and easy, so I'll just walk you through it real fast so that you can get to see how to get it. Next.
No, they don't. If you have family members that are in Dallas, it covers you. It's all over the country. PHCS is a national doctor.